At the beginning of lockdown, our district nursing team had a palliative patient with a diagnosis of leukemia who was being cared for at home by her husband, and they were living alongside their 2 young sons. The patient had carers and our team going in daily. For us it was to see her for medications administered by a syringe driver, so the house became quite a busy home care environment. The family were reluctant to have too many people going in and out of their home daily, not only because of her vulnerability to COVID, but also because they wanted to provide the care themselves for their wife and mum. The team sought to find a way of reducing the visits by teaching her husband how to administer the medications via the pump himself, so that he could perform this task daily for his wife. Her husband was fully aware of how to contact our team day or night to assist if that was required. When the patient did pass away, we received feedback from her husband that the opportunity to provide that care during such a difficult time allowed him to be closer to her in the last days of her life. With the absence of daily nurses, the clinical aspect of dying was taken away, and they were able to be together as a family in as much normality as was possible.
So during COVID, we worked closely with our local care homes and the carers within the homes, educating them in how to manage and change basic dressings, for example, new wounds such as skin tears, or to change dressings on already developed wounds that patients had. This reduced our footfall in entering the care homes and also gave our staff the capacity to visit our most vulnerable patients during this time.
At the onset of COVID-19, the remit of the Podiatry service has been hospital admission avoidance for our most vulnerable patients, those with diabetes, vascular disease and other neuropathies, and those patients who are at increased risk of lower limb amputation. At the start, we contacted all of the GP surgeries, community nursing teams and tissue viability nurses to inform them that our service was continuing to run through the lockdown, and to ensure that those patients had timely referral to our service, because the sooner the patients are referred, the better the prognosis for these patients. We saw patients at home. We increased our domiciliary caseload for those who were shielding, self-isolating. We opened up more high-risk community satellite clinics such as Oxted and Birchwood. Within the hospital site, our multidisciplinary diabetes foot clinic, we became early adopters of the virtual setup using Attend Anywhere, where patients could be seen by the MDT while being at a satellite clinic or in their own home. And we're continuing to do this. Patients in total contact casts were taken out of those and put into removable bespoke casts, so they didn't need that weekly visit up to the hospital during this most vulnerable time. We have worked very closely with our GPs, our community nursing teams, and continued joint visits with some of those patients with our TVMs, and our remit still is hospital admission avoidance for our most vulnerable patients.
In May of this year, the team was set up to cope with the new demographic of patient that was emerging with the coronavirus pandemic. The task was assigned to the community stroke and neuro rehab team and the pulmonary rehab service to cope with this new demographic of patient. Therapists were redeployed from both the acute sector and the musculoskeletal outpatient service to cope with this increased workload. The existing nature of the community stroke and neuro rehab team and the pulmonary rehab service meant they were well placed to run a multidisciplinary service that was going to cope with the various and complex needs that these patients presented with.
As Dan said, we joined with the pulmonary rehab team within First Community to provide a comprehensive service for this patient group. We were previously separate services, but we were able to combine ourselves to provide that service, and we design paperwork and processes and have regular meetings to make sure we're meeting the needs of this patient group, as I said. At the beginning, as a new service, we had to contact acute and community services such as GPs to let them know that our service was up and running and that we were able to offer assessments and treatment as required, and also just get our name out there to make sure we were getting all the referrals coming to us to make sure we were capturing as many people as we could within the East Surrey area. We're an evolving service. I guess that we're having an increased knowledge of the virus as we go along, and we're having to kind of review and adjust our service to make sure we meet the needs of the patients the best we can. And looking back at the last 6 months, I feel really proud to work for the service, and we've been able to get good patient outcomes and good patient feedback to know that we're providing an efficient service.
Prior to COVID-19, dietitians saw patients in all different settings, However, this was turned upside down when face-to-face appointments were put on hold. Business continued as usual, but with new innovative ways to make sure that dietetic support was still available. As part of this, we developed a number of resources to help those who might not be meeting their nutritional requirements during COVID. Our COVID-19 Food First sheet has useful hints and tips on how to increase calorie and protein intake, how to manage symptoms, and also some store cupboard ideas for those who might not be able to access food as easily as normal. We also have a suite of videos to help complement these resources. These show you how to make simple high calorie and protein recipes which patients can make in their own home, such as nourishing drinks and fortified milk. Our resources and our videos are all available on First Community's website.
Since COVID, we've had to change our physiotherapy practice a lot. Initially, we were doing all of our sessions online, video sessions with parents. It was really good for us because it helped us to improve our skills at explaining how to handle children. And it also really helped our parents because it helped them to be able to handle their children in a much better way.
As the months have gone on, we've been allowed to get back and actually see the children, which has been wonderful for us all. Us physios aren't good at sitting behind a desk. We're still doing our subjectives via the phone, finding out about the children and how they are via video calls, but then we're actually able to get hands-on in full PPE. We anticipated this wouldn't be much fun and that the children would get really upset when they see us, but actually we've had the opposite experience. They tend to play with our aprons, try to pull our gloves off, but just get stuck in like children do.
Reality is they found us really rather funny to look at, and we just had an awful lot of fun.
I'm talking to you today about how we responded to COVID. Immediately we contacted the parents and the families that we've been working with, and we tried our best to support them through telephone conversations and signposting to different organisations, and the health visitors were really great at supporting us to make sure that we signposted to the right places. And as things became clear that we were going to need to continue to work that way and that we weren't going to be redeployed, we had a lot of different decisions to make about short-term planning. It's meant that we've had to be really responsive. We've needed to work very differently with our families, to have very much more opportunities to communicate with them in lots of different ways. So we've been enabling parents to have information and activities sent to them via email. We've been recording videos and sending those so that they know how to put into practice things. And very quickly we were able to use WhatsApp for parents to be able to send information to us about their children too, to record what they're doing, so that we were able to tweak their plans and meet their needs. What else have we done? I think our IT colleagues have just been incredible at supporting us. Very quickly after we'd established WhatsApp as a good way of working, we found a much more professional way of working, and we're using Attend Anywhere now for all our first appointments. It's been really effective. Parents have been really positive about the simplicity of being able to click on a link and be able to see us. We know it's secure, and we've also been able to have some multidisciplinary team meetings too, using that, inviting other professionals to join in our meetings. So in some ways that's been really helpful for parents, save them travelling to awkward places and parking and settling, so that they're able to talk about the things that their children need. We've also been able to use Teams, and that was really brilliant. Just for us to be able to feel like we were able to see each other, to share information together, and we established a weekly huddle which was really supportive and really helpful. And right at that very beginning, when things were changing on almost like an hour by hour basis, we met every morning as a team just to check everyone was feeling well and knew what they were doing for the day. And that team's opportunity has been really great in establishing relationships between the teams when we've all been working at home, but also when we're working with our wider team across Surrey. So there's been masses of changes to the way that we work, and we're thrilled now to be starting to be meeting children face-to-face, meeting families face-to-face, offering clinic appointments, starting to book appointments in schools and nurseries, obviously with our PPE, which makes us feel safe and makes the parents know that we're keeping them safe too. And I guess the last thing that we're doing is having a trial now to see if we can deliver parent training via Zoom, and that pilot's about to start next month. So there's lots of changes in speech and language therapy in using different technologies to reach the families that we work with. It's been a really positive time, a really difficult time, but broadly, we're really happy with the changes that we've been able to make.
Baby Cafe is a drop-in session where mums or pregnant women can come and get questions answered by breastfeeding counsellors or peer supporters, but also allow them to meet other mums. It's normally held in a comfortable community space where mums can meet, chat, have a hot drink and cake. Once COVID hit, we realised it could not continue as it had due to the social distancing guidelines, so we had to think of other ways to offer this valuable service. We knew that Baby Cafe was really important to local mums, as it not only offers evidence-based feeding support, but it also brings mums together where they can talk and discuss what's happening with their children and their family lives in general. We started offering video calls via Zoom, and these were advertised on the Facebook pages of the individual Baby Cafe sites and via midwives and health visitors. The first session was a bit nerve-wracking, as I wasn't sure if people would be afraid to join the call or once there wouldn't say anything. I also wondered if there would be problems with the technology and I'd be left talking to myself. But with the help and support from the peer supporters, the first session and each session since has gone really well. There are sessions on each day of the week except Fridays. We provide a lot of technical help, such as sorting a painful latch and positioning issues, but a lot of our work is around feelings, expectations, early parenting, and these can be explored over Zoom the same as face-to-face. We've noticed that lockdown mums have experienced lots of anxiety and isolation and have found the Zoom calls a useful lifeline. One of our counsellors said that a mother had told her that the calls were the only reason to get dressed and put some makeup on that day. On another meeting, the mothers took each other's phone numbers to organise a socially distanced pram walk together. We have also had a sling session where a peer supporter who helps to run the East Surrey Sling Library came and discussed everything about slings. I can't wait for the Baby Cafe to resume in the normal way, but for now, the Zoom calls are the next best thing.